This right here is the type of video you want to watch till the very end, so that you'll be able to get all the details that is involved. You want to come to Ireland, you're already in Ireland, you want to know how you can become a healthcare assistant in Ireland, you want to know the financial implications, you want to know the salaries of healthcare assistant, you want to know if this is a good career choice, or you're just in Ireland and you're looking into moving into a new career pathway, and you are thinking if being a carer or healthcare assistant is something that you might want to venture into and you just don't know how to go about it. Thank you so much for clicking on this video, because you are just in the right place. Make sure you watch it all the way to the end so that you don't miss any details that I'm about to spill in this video. I've missed all of you guys, and thank you so much to a 1,500 subscribers on YouTube. For the past 3 weeks I've not posted any video. That's because there's just a lot of things happening all at once, and I'm very excited to be back here today and of course bring these long awaited videos to you guys, because I have received a number of questions on this topic. This is one thing I've always shy away from talking about, but today I need to make this particularly clear on how you can become a healthcare assistant in Ireland. Now, before I even go into the full details of this video, I want to let you know that being a carer in Ireland is one of the career pathway that is very fulfilling. It's financially rewarding, it's pensionable depending on where you work. And I know that when we are talking of anything career or anything job, we are always looking into the financial aspect of it, and trust me, it is really financial rewarding. As a matter of fact, I have seen carers who are earning almost, or if not more than, some nurses in this country. I once saw a carer who was earning like ×2 of what I earn in a month as a nurse. Yes, because your years of experience count into these. They just put all of them. If you are doing agencies, if you are working on Saturdays, if you are working on Sundays, trust me, it is financially rewarding. There's also like promotion, because every year you work, your salary increased, and all of that stuff is just an interesting pathway to go into. Now, but before you even get to all of this, who is a healthcare assistant? Now, for my folks in Nigeria, we do not have a healthcare assistant in Nigeria. I know some people might come for me in this video, but that is the absolute truth. Now, there are people here and there doing 3-month courses, doing this kind of courses, and claiming that are training to be healthcare assistants. There's no formal structure to the best of my knowledge, okay? But in countries like Ghana and some other African countries, they have the healthcare assistant school that people go graduate and then they can work in hospitals, okay? The people that we see more in the hospitals back in Nigeria as healthcare assistants, their job is not really clinical. They are more of running errands, cleaning portals and stuff like that. Okay, so in Ireland, a healthcare assistant or a carer is more of, some people call it nursing assistant. You know, you're just assisting the nurses. They can do like activities of daily living for the patient. They help make bed. They do a lot of stuff, okay? So most of them are trained in many other things. They go for trainings to do, depending on the area where you are and the kind of hospital you are, your job roles are always defined. And that's the good thing I like about this country. Now, that being said, let's get into how you can become one. So there are a number of ways. There's not really a very one strict rule, but one thing you need to know is that it is a formal career. So it's not just something you wake up one morning and become a healthcare assistant. The first set of people that can be or work as healthcare assistants are registered nurses. So like myself, as a registered nurse, I can decide, oh, I don't want to do nursing again, I want to go into becoming a healthcare assistant. I can actually do that directly without having to do any of those courses, okay? And that's one. Another set of people is like student nurses. So like student nurses who are like in their level 100, level 200, they can go into this, they start having that early clinical experience. So those are the people that can also work as healthcare assistants. Next is people who do not have any background in health at all, just like a normal human being, like some of you watching me now, and then they want to venture into the healthcare industry. So you have to do the courses. So in Ireland, there is what is called the level 5 healthcare course. So it's called the QQI level 5 healthcare course. So with this course, you have about 8 modules in it, 5 of which is compulsory, and you can just choose any other 3 to make it up, and then you get your certificate. This course can be offered online entirely, or it can be offline where you have to go to the campuses, or it could be a combination of both. Depending on your school, your circumstances, you choose whichever one that is best for you. The course usually lasts for a year, but it's 1 year course, but you could finish it in 6 months, less than 6 months, depending on how fast you are to finish the modules. So I want to use one particular school as the example of how the courses are being run. So on the application, you just apply to the schools, and then they will get back to you. They lead you through. You need to have a laptop if you want to do it online, because you won't be able to run it through a mobile phone, right? You need to have a laptop, and then they'll be releasing the welcoming, how your webinars, they release some modules. When you finish one, they release another one. So each of the modules have assignments and practical hours for you to be able to complete that particular module, right? So each of the modules could have something like a 20 hours practical experience, which is where the problem sometimes come into. So you need to either get to work in a nursing home or a hospital where you would do your practical hours. Now your work placement, that's the official term that is used. The work placement is most times a volunteer position where you will not be paid, but they will kind of train and monitor or supervise you. There are forms you're going to get from your school and submit to your supervisor at your place of work, and they are going to just have a go at the checklist, see if you're able to do those things. You already have your theory in school, so you know what is expected of you when you get to your work placement position. So you do the work placement with the number of prescribed hours that is attached to that particular module. Your supervisor at your place of work will sign you out, and then you submit it back to your teachers, and then they will know that okay, you've passed that particular module. Another one will be released. So this, like I said, could last for a year, or you could do this for less than 1 year. Most of the time, before you even get a job, most of the employers would want you to have at least 3 of the modules completed. For the HSC, according to the agent that I spoke with, she said they need you to complete 5 of the modules. So the modules consist of things like care skills, infection prevention and control, and stuff like that. I don't want to like spell everything out because I don't know how regulated this is, but yeah. So when you complete 5 of them, you're eligible to apply to the HSA, which is like the government here to work, or 3 of it, which most of the private agencies or hospitals will be looking for you to work. So as a healthcare assistant, you can work in diverse places, right? You can work in the hospital, you can work, which could be private or HSC hospitals. You can work in nursing homes, which could be private and HSC as well. You can work at the residential care. You can also do the intellectual disability module, which will allow you work with children that have disability. You could do the mental health module that will allow you work with the mental health institutions. So you could do like a one-on-one carer where you work with an agency, and then they will be sending you to somebody's house that needs help for a few things, and those ones are called the support worker. So there's a lot of roles available for it. Now, I talked about school, and I know you might want to ask, how much is this school? So for the school that I know, the fee is about 1,195 euros. Some of them could be lesser than that, and some of them could be higher than that. They want you to pay this fee all at once, and there are financing options, so you probably don't need to cough out this amount of money, especially if you are just starting to pay all at once. Now, to also become a healthcare assistant when you're already here, sometimes some people, especially the support agency, may take you without having to get the qualification, but it all depends on circumstances, and it's not very common. The common thing you will hear when you are applying for any of the positions will be that they need you to have this. Now, if you look at some recent job adverts for the salary, you would see something that ranges about 30,000 to about 34,000 as startup salary for healthcare assistant. So like I said, it's very financially rewarding, and the salary you just go up and up as you go down the year. So when you know have a bit of experience to your shoulders, you could decide to go agency. You just where you can get a good amount of money, even up to like 20 euro an hour or even more. Okay, but there's always difference between you having agency job and you having a full-time job, because other benefits are not there. So if you are having like a full-time job in a hospital or with the HSC of a big private hospitals, you would be like eligible to have like your sick leave, your pension, and all other should I say all other goodies that comes with being a permanent staff. Now, how do you even get into this? Right, I mentioned the course online. That one is very simple. You can apply. I'm talking from my personal experience. Looking for a work placement currently is crazy. It is very crazy. The reason I even wait till this time to make this video was because I needed to be sure of the information I'm putting out, because I want somebody to be able to hold me responsible of the things that I say, right? So when my husband came into this country, that was one of the options we had. Okay, and someone like me, being a nurse and being in the healthcare field, and someone like my husband who has always been interested in working in healthcare, even while he was on another graduate, and even after I got a job, he worked in a hospital in the admin department. He has always been interested in working in the healthcare sector. So when I presented the idea of being a healthcare assistant, he immediately bought into that idea. We paid for the school fee using the financing options, because it wasn't easy just coughing out that money to pay, using financing option with home, with Chevron College, right? He started doing the introduction, the webinars, them just showing you how the interface of the website, or there's how they call like the work phase or workspace of the student portal. You have other students you can interact with. You can always ask questions from your tutor. So for the theoretical part of it, it was very, very okay. He was coping just fine. In fact, he had done about 2 modules that was released to him, but the challenge was getting the work placement. We have applied to countless. When I mean we have applied to countless places, trust me, we have applied to countless places. The few that did get back came back with, unfortunately, we do not have a position for work placement at the moment. We do not have a position for work placements. Check back, keep checking on our website. So we resorted to just calling them. So we will look at the website, see if, because it's not even all facilities that you can do a work placement. It has to be like a formal case setting, okay, where you have like a multidisciplinary role. So if it is like agencies who recruit people to work as support workers. Those support workers, you can't use that experience as your work placements. The school won't accept it. They will only accept those ones you do in a nursing home or in a hospital or a mental health institution. Those are the only ones they will accept. They won't accept support worker. You just going to somebody's house to take care of them and then you fill that out. They don't accept that. Okay, so after several applications and several unfortunate messages, we cannot give up at the moment. But it's not something to say that others are not doing it. As a matter of fact, I know some people are still doing it, but it's very, very hard these days. I have spoken to a number of my colleagues. I've spoken to a number of people who have said, oh, I've finished the theoretical aspect of it, but I cannot get my work placement issue sorted. And because you can't get your work placement, you cannot submit your assignment, because from the school that my husband was enrolled in, right, they needed you to do the work placement so that you can submit everything together with the assignment. The assignment is not a problem. Yeah, it's an essay, but it's something that you can write. If they have any correction, they will correct you and then you can just adjust back. Those ones are not the issue. As a matter of fact, the presentation online, even if you are like a whole learner to anything health, anatomy and stuff like that, you will get them. You just need to read them line by line, watch the video presentations. It was actually easy, but the major challenge is the work placement. That is for those who are already in Ireland. Now let me say why I said that. The reason is because if you are not in Ireland, you are not allowed to do this course. Now, from my personal experience, when my husband was still back home and we had submitted his visa application, so I wanted a situation that he could start doing the online so that when he comes in, it would be a little bit easier. Reached out to the school. They told me, no, the person has to be in Ireland and needs to have a PPS number. So if you do not have a PPS number, you cannot be enrolled in. They can enroll you without a PPS number when you show evidence that you are currently in Ireland. And then at the end of your module, they can give you like admission letter. You use that to apply to get your PPS. Obviously, you entering into the country is already like maybe on a student visa, on a family visa. So there's that tendency you're definitely going to get, even though it took a while. So the reason they said is because you just have to be in Ireland. How can I move to Ireland as a healthcare assistant, right? You cannot do that, especially from that part of Africa. Now, there are some people that have heard that they've come into the country because they are nurses and they are not able to get their English language stuff sorted out, so they just say, okay, let them use this route to come into first. But that doesn't really apply to Africans that are especially on the red list, you see, because on the red list, the reason why there is even an international recruitment is because they want you to come and fill a role that is on the critical occupation list, and being a healthcare assistant is not on the critical skills occupation list. Also, if you are a healthcare assistant in Ireland, you are not eligible for the critical skills work permit. You will be given the general work permit. Yeah, that's the good thing. You are eligible to get the general work permit, which means your family can still join you, but after 12 months of you being here in Ireland. So coming from countries like Nigeria, Ghana, Zambia, and where majority of my viewers are from, is nearly impossible. I don't want to say impossible. It's nearly impossible, because before you can work as a healthcare assistant, like I said, you need that qualification, and you cannot get that qualification if you are not already in Ireland. So I hope that answers your question, please. So you understand that all those people you see advertising, and I've even had some people, I had a lady who sent me a message on Instagram and said that she was told to pay 4,000 euros, that they would bring her to Ireland and give her a job as a healthcare assistant, and she would be receiving 800 euros every week. Now, while I did not doubt the possibility of a 800 euros every week, because that is possible if you have many years of experience as a healthcare assistant, I doubt, because any international recruitment is free. I told her, this money, how did they want you to pay? Did they say, okay, when you come into Ireland and start working, they're going to get this money from you? She said no. They told her to pay 2,000 euros up front, and then when she arrives in Ireland, when her visa is out, she would then pay the remaining 2,000 euros. Just imagine somebody in Nigeria coughing up 2,000 euros. Let's use the bare minimum exchange rate, 1,700, to multiply that. How much is that? And you just cough out that to pay somebody. If I get 2,000 euros in this country for free, oh boy, 1,700 multiplied by 2,000, that is giving me 3.4 million naira. So you cough that out and give it to someone, and you think they are going to continue talking to you. They'll just get the money, find a way, and block you out. Either they block you or they just keep stalling you with stories. I've also had a very close person who has told me that she paid some amount of money. She was a registered nurse, has paid some amount of money for them to bring her in as a healthcare assistant. That money was gone, because it just cannot happen. I know that when I say things like this, it feels mean. Some people would say, oh, you're only saying that because you're a nurse, you have the opportunity to go, blah, blah, blah. Yes, it sounds mean, but it is the truth. I don't want any of my channels or any of my videos to be about luring people into what is not achievable. Currently, even as a registered nurse, it is very challenging to get a job because of the wait list. It's becoming very, very challenging. Okay, and self-sponsorship seems to be the only option, which is not cheap. It's not cheap. I had to even call some agencies to speak with them. Okay, if my friends are able to come into the country on self-sponsorship, will you give them the job after they get their license? They said it's a yes and no answer, because sometimes employers don't want to like pay for that critical skills, give you that job, all those sponsorship stuff, but they can be able to get you a job to work, but for how long? And you cannot work if you do not have a work permit. That's illegal. Okay, that's illegal. So I hope this answers your question. To refresh what I just said, for you to become a healthcare assistant, you need to undergo the training of the QQI level 5 healthcare course. You can only do the course when you're already here in Ireland. You can also be a healthcare assistant or a carer if you're a registered nurse, if you're a student nurse. Okay, those are the options. For you to come into Ireland as a healthcare assistant, even as a nurse from the red listed countries, is nearly impossible. Now, that does not stop you from applying. You could try your luck. Even after you've applied, when you're already here to get the course done, to get a job placement, it's like trying to pass an elephant into an eye of a needle, if you know what that adage means. I hope this clarifies a lot of questions, and I hope this does not make you hate me because I now seem like the bearer of bad news. But no, I just want to let this out there so that people would know what is the absolute truth. And I'll see you in my next video. If you enjoyed this video, please give it a like, subscribe to my channel. Let's meet in the comments and discuss anything further.